What's the evidence against giving too much oxygen to patients in the hospital? And are we actually causing a lot of harm? So high levels of oxygen, typically after a PaO2 of above 100 millimeters of mercury, is when you start to get a lot of reactive oxygen species that causes poor mucociliary clearance, surfactant impairment, airway irritation, alterations in microbiota, inflammation, and cell damage. In the BMJ in 1976, you can see that 200 patients with suspected MI were randomized to 6 liters of oxygen versus room air, and there was found to have increased sinus tachycardia, as well as increased rate of MI recurrence. In the oxygen ICU trial, there were 480 critically ill patients randomized to liberal oxygen versus conservative oxygen, and there was increased mortality in the liberal oxygen group, and it was a pretty significant amount too, 20.2% versus 11.6%. And there was also a similar trial in France that showed increased pneumothorax, clinically relevant bleeding, MI, and arrhythmias.